Shiju, am I visible, audible?
Yes, yes.
Is the slides also visible?
Yes, it is.
Okay, I'm checking it. Okay, thank you. I think we can start.
Nisha. Sridevi.
Shiju, I think we can start.
Yes. I am waiting for Nisha to welcome speech. Nisha.
Hello,
Yes.
can you hear me? Okay, fine. Audio is now ready. Hi, good evening. Welcome to all doctors and other personals to the national webinar conducted by SNA Oushadhasala on the topic Challenging Conditions and Best Prescriptions. SNA Oushadhasala is one of the pioneers in Ayurveda, belongs to one of the Ashtavaidya family, Trishur Thaikad. Ashtavaidyas are considered to be the masters of Ashtanga Vaidya and authorities in Ayurvedic system of medicines in Kerala. SNA established by the famous Ashtavaidya Trishur Thaikad Undimus in the year 1920 with a vision of large-scale manufacturing of Ayurvedic medicines. It's a blend of traditional expertise and modern technology, thereby assuring efficacy and quality in all the activities engaged by them. Dr. A.N. Narayanan Nambi, Director of Academic and Clinical Services of SNA Oushadhasala, is the speaker of today's webinar. Dr. A.N. Narayanan Nambi took his MD in Kaya Chikitsa from Rajiv Gandhi University of Health Sciences. He is continuously contributing his knowledge and experiences in the field of Ayurveda education, healthcare and policy matters in India and abroad since 20 years. Dr. Nambi is from a well-known ancestry of Alathur Nambi family of Ashtavaidyas, the great traditional Vaidya families in Kerala, having centuries of old tradition. He has done countless seminars and classes all over India and abroad. As an experienced person in both traditional and modern way, he can share his experiences and give various tips to all of us. Now, I would like to welcome Dr. Narayanan Nambi to the webinar. Welcome, Doctor.
Thank you, Nisha. Am I audible well?
Yes.
Thank you for the organizers of SNA for selecting a different topic called challenging conditions as best prescriptions. Generally, whenever we speak about clinical practices, we often think about diseases that frequently appearing in our clinical practice. But here I would like to highlight few challenging conditions. Challenging condition in the sense it's not necessary initially, not necessary to be very difficult to or it's a fatal. Rather, there are some diseases that comes in our OPD very frequently, and it will be repeatedly coming to our hand, and we are forced to do something to that conditions, and very oftenly we'll be in a bit confusion how to tackle this problem. So in the first part of my presentation, I would like to keep a few diseases like carpal tunnel syndrome, like plantar fasciitis, like vertigo, like irritable bowel syndrome. There are some set of few diseases which oftenly we faces in our day-to-day practice, and oftenly we will be in a little bit confusion, or we'll be looking for some of the best prescriptions, and My highlightation to that presentation will be of some of my best prescriptions and what I have seen in my family, like my father or some of our teachers, how they are handling this. And in the second part of it, I would like to highlight few diseases, which is oftenly comes in our inpatient status, which one is a neurodegenerative disease. Very oftenly we get it like Parkinsonism. And second one is the another neurodegenerative conditions, which is more fatal. The lifespan is hardly from 3 to 5 years, or maybe a little less or more, called motor neuron disease. So these are the few things I would like to speak in the next one and a half hour. And by and large, basically I'm a clinician. So my focus will be more on the clinical perspective, not from the conceptual or not from the textual perspective. My focus is largely on some of the best formulations of classical textbook formulations and how we can make use of these formulations in the challenging conditions in our day-to-day practice. So generally, when we are a clinical medicine practitioner, the three things we'll keep it in mind. One is a Hedu Jnanam, second one is a Linga Jnana, and the third one is Oushadha Jnana. So Hedu Jnana, that is the knowledge about the etiological factors. Many diseases we may be able to know the etiological factors, but a large number of diseases sometimes we may not be able to know exactly how it happens, at least from the modern parlance. Of course, from Ayurvedic parlance, very oftenly we may able to say this is because of so and so, etc. And the second part of it was about the Linga Jnana, but the symptomatological presentations, and we'll be challenged very oftenly with the current modern diagnostic perspective. How can we understand this disease from an existing information what we have in the textbook about an Ayurveda, and how we can how we compare, how we make a parallel to it, and what are the things. And at the third perception, we have been a challenge in our mind that what are the best prescriptions we could take, what are the things whether to be managed in the OPD level or in IPD level. If it is in IPD level, then also what are the medicines or what are the treatment which can be delivered that can bring the fastest result as possible, and what are the medicines that at least that could not hamper or make any problem to the patient, or what are the precautions we should take. There are these set of things. So as a clinical perspective, three domain commonly keeping in our mind. One is a Hedu Jnana, one is a Linga Jnana, and Oushadha Jnana. So let me take a few examples. For example, when we have a Vata Vyadhi, okay, we'll say from Ayurveda, okay, there's an imbalance of Vata is there. Very oftenly, it may extend it to the Vegadharani Adhyayam also. So that means starting from, for example, somebody is telling that I have an anorectal problem. Maybe if we root back to the origin of the disease, it may be a continuous exposure to sitting, or continuous exposure to very hot climate, or it may be continuous consumption of very hot spicy food. But sometimes it even extended to the reasons of like Vega Vidharana. And symptomatologically, maybe some constipation or originally started, but later on. And so the Oushadha Jnana is Eranda. You know, this triad, Hedu Linga Oushadha Jnana, is a very fundamental nature of Ayurveda, very oftenly highly valued, because our perceptions are, the disease perception in Ayurveda is totally different from the conventional medicine. Whereas for a conventional medicine people, if there is a constipation, let us take some laxative, that's all. But for us, we may be analyzing about the Abhana Dushti, then we may considering about Udavarta possibilities. So we may think about Samana, Udana, Vyana, even Prana sometime. And keeping all the track of all these five Vada, we may think about the possibilities of it. So let us take some few examples here. So let's have some Vyadhi Vicharam. So from Prana, from vertigo, some allergy. So I'm just putting some idea to you in the beginning, and we'll go to the details of this disease in a systematic way, in a very simple way, so that very oftenly we get a patient oftenly comes in a clinic complaining of vertigo. Or when they consult a modern medical doctor, oftenly they will consider two things. One may be a cervical spondylosis. They may be thinking that a cervical spondylosis, or maybe second section, maybe people may be thinking that it may be something related with the ear. And if most of the time they'll be given Vertin or Stigeron like medicines oftenly prescribed, and whenever they take these medicines, oftenly the symptom will be disappeared, but they have to have these medicines repeatedly whenever they want to travel, whenever they want to do many things. But when we go to the details of this etiology of this vertigo, it may be starting from a central issues like cervical spondylosis, or even from a multiple sclerosis or Parkinson's disease. This is very common to have vertigos. And sometimes it may be a simple BPPV like benign paroxysmal vertigos, or even infections of the inner ear, something like that. So it is very important for us to know the cause, how this is happened. Not simply having a prescription will not be worth. And what often they will have, they complain, is a sensitization or a sensation of a spinning. That means that the person will feel, especially when they bend the head forward, like when they take bath in the bathroom, or sometimes they forward or backward bendings and all. Oftenly they will have a spinning of the head, or it may spare for a few minutes, or sometimes it may go to more, maybe an hour or so. So if we get such diseases, it is very challenging for us to handle such cases, and we may be thinking what to do. So how vertigo should be managed. But so from Ayurvedic point of view, Brahmam is a challenging thing, and whenever we have Brahmam, it is related with Pitta is also there, Vata is also there. Also, whenever we think about the Rasadhadu, many of the Rasadhadu symptomatologies are associated. So thinking on that Rasadhadu, you start giving prescriptions, you'll get good results. So you take the Vidajyadi Kashayam, you give Vidajyadi Kashayam. Normally we prescribe Vidajyadi Kashayam to the Kasaswasam, especially that Vidaji, Vanjangala, Vichiga Devaha, Supiparnam, that Yogam, Asthanadam, Sutrasthanam, Vidajyadi Ganam. Normally we use this Vidajyadi Ganam for Brahmana purposes, or sometimes we use also for cough and even for the children and all. But you try to give Vidajyadi Kashayam, you will get very good results. Because that will address us well with Rasadhadu, also addresses well with Vada Pitta Shamanatam is also available. Another option you have is the Drakshadi Kashayam, Draksha Madhuga Madhuga Kashmiri Shadipa. That's in the Jara context for the Kashayam which is available. That Drakshadi Kashayam is also very good if the person is having repeated vertigos, and if that vertigo is associated with inner ear problems, or if the vertigo is associated maybe due to the migraine and all, then definitely with the Drakshadi Kashayam is another very nice drug of choice. Then another drug medicine very oftenly we use is Kalyanagam Kashayam, the Varavishala Vatrela, Varavishala Kashayam or Kalyanagam Kashayam. Again, very oftenly we think about using Kalyanagam Kashayam in some psychological problems or some oligospermias. There are wide range of different situations we use Kalyanagam, but we get very good result also Kalyanagam Kashayam. Whenever we have some Kabhanabandhatva is there, you get very good result. Another very good preparation to use in the vertigo is the Dhatyadikshadam. Dhatrividari that Dhatyadikshadam is from Sahasra Yogam, a famous yogam commonly prescribed for Moksha, Madhya, Unmada and all. Another segment in the pediatric practice, the children with having ADHD, children with having behavioral disturbances and all. Dhatyadikshadam is a very common prescription. In the gynecological domain, they will use this for whenever they have Pythiga type of presentations like dysmenorrhea with burning sensations or like that and all. But here also you will get very good results by using Dhatriyadi. If you don't have the Dhatriyadi Kritam, another choice is the Tiktaka Kritam. That is the Padola Nimbagadu Gadavi Padadurala. In the Kushta Jigilsa, the first yogam, the Tiktaka Kritam is also another very, very good choice. Often, if you try to use Nasyam, especially Pradimarsha Nasyam, Chidabala Thailam or Karpasa Astyadi, like Pradimarsha Nasyam is also very well in practice. I often prescribe people to use Pradimarsha Nasyam in a different way. Instead of putting in the things in the nostril, I will ask the patient to take a spoon, add, for example, 6 drops of oil in that spoon, let the spoon be warm, and I will ask the patient to dip their small fingers into that oil 2-3 times, yes. And I'll ask the patient to insert their own small finger inside the nostril and take a deep inhalation in both the nostrils. And again, they dip it, again, inhalation. So it's not like sitting in laying down in a supine position and taking the Nasyam with the help of another person. In a practical way of Pradimarsha Nasyam, which found very successfully, if it's been practiced for longer months together, found very, very effective. Whether it is Shirabala or Karpasa Astyadi, if it is a more kapha dominant situation, you may prefer Karpasa Astyadi. If it is more Vata Pitta, then Shirabala may be the medicine of choice. Another very unique thing is that usage of Mahamasha Thailam on the head. Very oftenly, when there is a wasting, when there is a Brahmana type of nature is needed, people use Mahamasha Thailam for a local application whenever there is a muscle wasting. Because of that formula itself is a very Brahmana. But clinically, we found very effective using Mahamasha Thailam on the head. Just like a Shirobhyanga, take a small amount of Mahamasha Thailam, have a head massage and take bath. Another yogam also found very good is Karaskaradi Thailam, but it is not very popular Thailam. Karaskaram is Karaskara is a medicine plant, and the Kalkam and Kashayam is also made out of Karaskaram. Some formula they will add little Devadaru also as a Kalkam. Milk is also there. These are some of the classical preparations, depends upon the avastha. For example, cervical spondylosis, induced vertigo, definitely Pradimarsha Nasyam, Mahamasha Thailam, Shirobhyanga will be very, very beneficial because it also addresses both the things, because it's also Brahmanam, it's also good for Dhatu and other things. So I was just, my intention to say these are some of the best prescriptions because these are all time tested, these are all the classical formulas, but I would like to say we are using in a practice of different clinical conditions, just for the purpose. Now, another common clinical symptom we get in a challenging symptom is the allergy. Very oftenly, people comes in the clinic complaining that doctor, I have sneezing, I have blockage of the nose. Sometimes I have dry itchings and very difficulties, some allergic to many things, and very oftenly this may be related with and associated with headaches or a running nose, cough, itching of the throat or other things areas are also there. And again, most of the time we may think about allergies and we prescribe not a classical product, rather we think about using some of the patent products, or sometimes we don't really understand how to handle this. But there are very powerful medicines in our classical book. Consider that there is a Vata association. Of course, there is an association of Kapha because of the Klayeda Pradhanatva is there. There is also a Rasadhatu problem is there. Considering also Jora as well as the Rajakshma, Penasam, Khasam, Shasam, and all the Tridubi, Rajakshma is also there. Considering these are things, you get some of the medicines, classical medicines are excellent results. One is the Vyakriyadika Shayam, which is described in the Jara Pragana, Vyakri Shundyamata, that is Vyakri Shundyamata, Pipali Juna Samyuvi, that one. Again, there is another Vyakhya Kashayam described just after few slokas of in the Jara Prakarnam, that is Nagaram Pushkaram Mulam Guruji Katakarika. There Pushkaram Mulam is also added in that formula, which is again much more effective in most of these upper respiratory allergic things. People complaining that there is a sneezing. Early morning, I woke up, I will sneeze 10 or 15 times, then I'll feel like an itching in the nose, followed by a running nose. There is a rhinorrhea. Then the whole day nose is blocked. So I keep on inhaling. Then I'll get sinus weightage. Then later on I may feel a fever. Like that they will complain typically. Where Vyakrayadi found very, very effective. Another choice is Amrutottanam. Very oftenly we don't consider Amrutottanam. Amrutottanam we oftenly use in feverish stages of different diseases, or like in a rheumatoid arthritis, or in many Vadavyadis or Vadashonida situations. But not only that, because Nagaramrita Haritaki combination is an excellent combination for such situations. And some of the medicines, classical medicines like Abhayarishtam. If you give Abhayarishtam in a long duration, that's also found very, very effective. And an Amalakasavam. Amalakasavam actually is a preparation containing Amalaki and Haridra. Actually, it is a formula modified from Prameha Jilsa. Sarvameheshu Paye, Dhatri Rasapudam Plane, Haridra, Makshiganida. So Haridra and Dhatri Rasa. Not Makshiga is not added there. So it is an Amalaki and very actually called from Prameha. But Amalaki and Haridra, of course, you can understand that combination will be excellent. Even in Nishamalagi Churnam or Thatri Nishadi Churnam is also found very, very effective in such conditions. Those who are having allergic situations, Amalagi and Haridra combinations are very effective. Even the products like Chukundipalli Guliga, the products like Dushi Vishadi Guliga, again found very, very effective. Single herbs like Haridra, Amalaki, Gutuchi, if you try to use it in a single herb also, in a long run, they will bring very, very result. The person who's having allergic for long years together, after a course of this type of treatment, Vyakrayadi, Amrutottanam, or don't take Chukundipalli for longer time because of the Oushadhis and some challenges are also found if it is given for months together. Generally, you give it short period. Then you may switch on to the Kridam-like preparations or Avaleham-like preparations, Chavanaprashins-like preparations, or Indugandha Kridam or Shatpala Kridam. These are very nice formula mentioned in the Rajyakshma. Shira Shatpala Kridam is an excellent yoga that can be used in allergy, found very, very effective. And the simplest method to stop the rhinorrhea, the continuous watery things from the nose, is Haridra Thumam. Take turmeric powder in a cotton cloth, make it like a roll, burn it, add little ghee and burn it. Or maybe you can add Tilathaila also. You just burn it, and that smoke is inhaled through a cone of paper. Inhale, then that immediately stop the secretion for a shorter period, but long time prescription is needed to improve the condition. So this is actually one of the title, as I mentioned, that is the challenging condition, because these are the patients, they come in a clinic and saying that, okay, I am taking so and so medicines, but I got some result in the initial stage, then it didn't get didn't get good result later stage. So Ayurveda have that approach handling the longer run. Another condition commonly nowadays, a lot of people are comes with this complaining that they have a pain, mostly numbness or a weakness in the lower extremities, especially in the arm. Very clinically easy to diagnose a carpal tunnel syndrome. Sometimes they may be already underwent an electric study, so they will have a report of the study of the neuroconduction studies So they will say that, okay, there is a bilateral carpal tunnel syndrome is established. And generally, they will be surgeon, they will be referred to a surgeon, and surgeon say, we are going, it is better you undergo a surgical repair because there is a problem because of the blockage. So people will be a little bit worried about this problem and oftenly complain that, okay, better, why can't we think about an alternative option? They will consult even some physiotherapists, so they will recommend some physiotherapy, some hot water, cold water dipping. Sometimes they prescribe a specific type of wrist bandages and reduces the usage of the keyboard, or if you're using the keyboard, use it in a different way. Like that, they will have innumerable options. Nowadays, by Dr. Google and Dr. YouTube will give a lot of informations, and people will try to follow these things. Oftenly, it may help them, but still they will be in a position to have a question in their mind that shall we think about an alternative options like an Ayurveda. So they will come to us and asking about any help from Ayurveda, and shall we try to do something. So there is also, again, we have a Vada Vyadhi, and here the problem is largely due to an Avarana. Avarana avastha is happening very oftenly. And such situations, some of the best prescription, one is a Gugulu Tiktakam. Nimbam, Doshapadola, Vigdigana, Hagan, that Gugulu Tiktakam Kashayam is an excellent yoga. You try it with that, you will get very good results. If there are people are hesitant to use Kashayam, you can use the Nimbamradasavam. The same thing is made out of an Asava formulation. So you can use Nimbamradasavam. So if you try to give added with a Shaddarna Churnam, with a Nimbamradasavam, it is very, very effective, except the palatability is very poor. Otherwise, it is very, very effective. Nimbamradasavam in Shaddarna Churnam is one of my frequent prescriptions in such cases, and I used to get excellent results with that. The Shaddarna Churnam is very popular to Darvi Galinga Gadagadi Vishaknapada, Sushmariso, Dharana Pramanam. Like Shushudha Vada Vyadikilsa also in Ashtangadem and all, you get that Shaddarna Churnam. Amashe Gadevade. It is actually described for the Amashe Gadavada disease, but here also we will use it and we'll get very good results. Another option, if they are complaining too much of numbness, some radiculopathy, involvement of brachioradiculopathy association is there. Along with instead of Gugulu Tiktakam, you will get a better result with Ashtavargam. The Belasajare and the Shundi Rasna Surudrama Yoga of Sahasra Yoga. Otherwise, if it is associated with cervical spondylosis extended to the brachial radiculopathy, extended to the arm, more or less you have some more entrapped syndromes are there, then you can start with some Shaddarnam or Ashtavargam, but later you switch on to Bhadradharvadi Kashayam. Bhadradharinadam Gushtam Dashamulam Beladuyam of Vadavyadhi of Shodhanadi Ganasangram is an excellent yogam that can be used, and you will get a very good result. Very little bit Brahmana in yoga. Dashamulam Beladuyam is also there. Some Brahmana Subhava is also there. So you will get good result with that. Generally, if you try to give some Kleda Soshna yogam, generally Shodhana yogams like Ardhavillam or Punarnavasavam. Ardhavillam and all very popular prescriptions in the classical medicine. You try it, you will get very good results. Another formula is the Gugulu Panchabalam. If one side, if you try to do the Shaddaranam, another common prescription you can combine is Ashtavargam Kashayam with Gugulu Panchabalam. One of the formula where we have highest proportion of Gugulu, suppose if we are giving 1 teaspoon of Gugulu Panchabalam Churnam, around 4 to 5 grams, then the proportion of Gugulu is so high in that. And also very effective. Only thing that if you give little longer duration, people may complaining of some burning sensation in the stomach occasionally, or sometimes they have a mild constipation. Otherwise, everything is fine. Upanaham, local Upanaham, Upanaham Vajagunwa Shadakwa Devadaribi. That local Upanaha Churnam application found very effective. Ask the patient to make a bandage in the Upanaham in the local area. Again, the Karaskaradi Thailam. Karaskaradi Thailam is local Abhyanga is an excellent choice, Or even the Kotanjukadi Churnam, the famous Kotanjukadi Thailam is made into powder. The same ingredient is made into Kotanjuku and Mishkulation, Pathodi, Devadimam, Siddharthan, that yoga. Siddharthan, Dadna Jinjar say that yoga. So Kotanjukadi Churnam is available in the market. So you make it a key, quarterly swedam on the wrist, longer duration, and 10 to 15 days itself, they will have a drastic reduction of numbness and pain, which is a long-lasting one. So, what I want to say at this moment regarding the carpal tunnel syndrome is that one side we have to give some oral medicines to reduce the avarana and vata and Adhd. Other side we have to give some local application to have the symptomatic relief. But whatever the result we get in this period will be a very long-standing. Like normally people will undergo a surgery, they will have very immediate result after surgery. But thing is that we have found practically I have found a lot of cases, even after a 6 months or any year before itself, they will have already the same symptoms, almost the same complaint, and they're already fed up with the surgery. But whereas when those were already taken a regular prescriptions for a few months with Ayurvedic medicine, found that very successfully we could be able to reduce this problem, as well as in many cases it can completely cure that problem. Even oral medicines like Kotanjukadi Thailam, small amount of Kotanjukadi Thailam, if you give it also, found very good result. Another disease in our clinical practice we get is plantar fasciitis. Nowadays, lot of people comes in our clinic complaining of the heel pain. The moment they sit, they are fine. The moment they start walking, they will have a severe pain in the posterior aspect of the plantar area of this because of the inflammation of the plantar fascia. It may be associated with some gout, it may be associated with some other reason. Sometimes it may be due to the overweight, or it may be due to an anatomical problem of the foot curvature. It may be many other reasons, but very oftenly people comes with this complaint, and we'll be in a challenge and to ask this. And they will oftenly complain that the pain, first steps, they'll have very difficulty playing, constant foot pain will be there. And they'll be consulted doctors, and they'll be recommended to use different type of chappals like MCR chappals, and they will give sometime a soft pad inside the shoe. Sometime they will ask to even to take a shot of steroid, corticosteroid from the local to reduce the inflammation and swelling. But oftenly it will not be very successful. It will not be so successful in the practices. Rather, they will have some challenges. Sometimes it's not only plantar fasciitis, they may have a calcaneus spur. There will be severe pain. If we take the X-ray, you can see the spur formation in the calcaneum bone. It may be sometimes associated with Achilles tendinitis, like in the little bit upper areas also. We have these type of challenges. So what to do? Of course, here again, Vata and Adhd problem, and also some Shobham is also there. And in Ayurveda, we have so many very powerful classical medicines we should use. Why I want to highlight that very oftenly, the biggest challenge we are facing nowadays is that classical medicines, many people have hesitation to use because they didn't really understand the spectrum of dimensions, how it can be used. Because unfortunately, sometimes the Phalashruti may be having very little thing. Ashtavargo Anilabaha. Okay, it is good for Vata Vyadhi. What Vata Vyadhi? What type of Vata Vyadhi? What extent of Vata Vyadhi? Which in Dhatu problem? What are the combination of dosha it is? But when you start practicing this classical formula, the biggest advantage is that these are all very time-tested formulas. and very excellent in bringing results. Meantime, it also have a great potential to correct the whole system. Even though it is a patient may be complaining a local problem, it may be a localized issue, but that formula itself has a great potential to correct some Agni. For example, we are giving an Amargotharam to a patient, or for example, we are giving an Adhari Kashayam to a patient, Adhari Sahajaradi Kashayam or Adhari Kashayam given. So it's containing medicine that improve the Agni, that improve the Dhatu Agni, that there are many other things which will unknowingly or knowingly we get the benefit. So that's a very critical point. We should always remember that usage of classical formulas are, that's why it is survived for such a long duration. I'm not against to any other products, but I strongly recommend people to retrospect the classical formulas, try to use it as much as possible, and moreover, we have to explore the dimensions of each formula as much as we can. So there are different clinicians can have different opinions, and different clinician may have different observation with the topics. Like I used to speak like a topic called non-yogas and unknown indications. So something like that. So coming to the point, so Adharigadi and Sahajaradi Kashayam, so Sahajaram Suradharu Sanagaram, that famous yoga, also found very good result. Ashtavargam Kashayam and Gugludik Kashayam is another common prescriptions which we get good result, depends upon the avastha or the stages of it. Another good choice instead of Gugludik Kashayam is Nimbamrdasavam, again the same formula of Gugludik Kashayam but in Asava form, which can be used with the combinations like Kogilakshadasam. That is in the Vadashwani, the Kogilakshasya Nijuho. It's a formula in the Kogilakshadasam. So Kogilaksham is a good combination, or Punarnavasam is again a good combination, which we can make use of it, giving good results in a long duration. In the while explaining about the Pindadailam, Vadarakta Rujabaham, Padaharsham, Padatodam and all, there is another Pindadailam, adjacent to Pindadailam Yogam is Khajita Pindadailam, Aranala Adhake. So that Khajita Pindadailam is, it comes like a gel form, Oftenly I prescribe people to use Khajita Pindadailam on the local area, in the plantar fascia area. Either I will recommend the people to use the Arka plant leaf, make it warm and give us Vedana with Arka plant. Or if it is Arka plant is not available, then I will prescribe Kotanjukadi Churnam, take the Kotanjukadi Churnam, make it warm like a local Vedana with Kotanjukadi Churnam, found very effective. If Khajita Pindadailam is not used, then Karpasasya is also another good Thailam to get good results. And again, if you give simple Tila Udvartanam, simple Tila, you take the Tila powder and add with a little Dhanyamlam and give an Udvartanam in the foot with the Tila Udvartanam, also found very effective. You know, sometimes Khajita maybe some medicines may be a bit expensive. There are situations we'll get very poor people also in our practice. So we may give some Valuga Svedam, or we may ask them to do some simple procedures like Tila Udvartanam that can be done with the least cost, bringing also very good results. In the hospitals, when people comes with obesity and other time, sometimes associated with complaining of plantar fasciitis, I often prescribe them to have Annalepanam, just like Navarakili, do Annalepa. Even in the household, olden times, we used to say to the old ladies that immediately after the rice cooking, you know, you turn out the ganji, that watery part out. Then just before you tilting back, just you tilt back the rice after maybe a few minutes. Once the watery part is removed, take little rice out of which, little bit warm out of it, just keep it for a minute or few minutes to just to reduce the high temperature. Then take that rice and you just give a massage with that rice on your feet. That rice which is you are eating, very simple method. You try to use that on the foot because it's a very Brahmana, it is also a Snehana, Svedana nature will be there. There is no Snehana, but there is a Svedana nature is there. It also found very good results. Beware that it should not burn the soul. So that's what just check the temperature of it. It is also another one is the foot massage. Foot massage, not the padakhadam or the massaging with the foot. Rather, allow the patient to take the foot in a hot stones, the garden stones and all the yellow color, the white color stones, which in the sunlight it may be very, very hot. You take that stone, give massage on soul, or you rub your soul on that type of stone. Also found very, very good result without any much expense. So there are so many such simple things, but we could able to bring good results. Another common disease comes nowadays. This disease is increasing higher, even in the younger students also. We are getting nowadays a lot of students also coming with this problem of initially starting with increased gut sensitivity. They are saying that whenever I take some food, I have to go toilet. Then even if I get some stress, I have to go toilet. But this tendency of irritable changes later on manifests like a larger problem of an inflammatory bowel disease. Maybe later on it may start with an irritable bowel, but later on it may be changing to more challenging disease like a Crohn's. So we have to be more cautious about it. Very oftenly, the sensitivity to gluten, like milk and milk products, if they take, they'll have the problem. Very oftenly, the cause is fine because of the gut-brain axis and all. Nowadays, in the Western people, again, it's a very, very common problem. IBS is a very common problem, and more than the gut, they are totally disturbed because of their fatigueness, lack of energy, multiple joint pain. Of course, GIT disturbances will be there, either diarrhea or constipation, which comes and goes, murbadam, hurdravam, like that, sometimes abdominal cramps, sometimes the bloating, and there are so many other things happening. At this point, it is actually not a quick OPD level management is not sufficient. Of course, we can start with an OPD level, we may switch on to IPD level, but we have to explain the patient that this is a long-standing problem. You have to take a long, maybe years together. You take the medicine properly in a proper way. We'll give recommendations to the diet. You just follow as much as possible. These are very critical because here we have the Adisara, Grahani, Shobha. Many things are combined together. Sometimes it also totally disturbs all the harmony of even Udana, Prana, Samana, Apana, even from the Prana level. I oftenly start my prescription with the Chiruviladi Kashayam, even though it is normally used in ulcers and all, but Chiruviladi is a good choice to start with because it can create a lot of corrections in the Apana. It's a very good choice. Or if you want to address the person is a little bit weak, complaining of tiredness and all, you may start with the Drakshadi Kashayam, or if their symptoms are more associated with psychological things like stress and anxieties and mood disturbances and all, you may start with Kalyana Kashayam. But the problem in the Kalyana Kashayam is it is a little bit laxative in nature is there, whereas Drakshadi doesn't have, it is a little bit Sambana nature is there. Tirulari is in between. Again, depends upon the avastha, the status, you may choose accordingly. Another good medicine, but nowadays it's not commonly practiced, is a Madhugasana. Actually, it is described in the Vaishyaratnavadi for the Grahani and all the children's olden practices that there is a usage of Madhugasana. Excellent yoga. Mustarishtam, Kodajarishtam and all, of course, you are all well known about this product, but Madhugasana is also a very good choice. Pilluadi Leham, Kodajatogadi Leham, also both also very good for creating a good control of the apana. And if they are complaining bloating of gas and a little bit abdominal disturbance and all, there is an excellent formula called Pathyabadakam. Jasen Amalagekshunam Kridaprastam Vibhaje, Pathyabadam Pibetsati, Vishesha Pitta Gulmani. In the Gulma Chikitsa, of course, whenever we get this type of problem, we think about the chapter of Gulma. No? So we have Vada Gulma, Pitta Gulma. The Pitta Gulma Chikitsa, we get a nice formula called Pathyabadakam, which is a excellent choice, simple formula. The same very good result. I oftenly prescribe people. It's also very tasty to take because amalaki, rasena amalaka, amalaka rasa is there, ikshu rasa is there. So all this generally, most of the geese are not at all palatable except Radimadi Kridam, Pathyabada Kridam, so maybe a little bit Indugana Kridam also, but Pathyabadam is one of the nice taste medicine as well for the IBS and all. And if the patient is in the hospital and all, definitely we may think about usage of Navaraki Takradhara. Takradhara, yes. Takradhara is a very good choice such patient because we found clinically that the gut-brain axis related issues, whenever we get that time, that Takram have some great role to play. Like in many of these psoriatic conditions, that Costa is related thing, Takradhara is very effective. Like Navaraki, Shashtikashali Pindasvedam. That is a Shashtikashali Pindasvedam. Is also a very good choice at that moment. Then the fibroid uterus, this is another disease. Fibroid uterus is another disease. Very commonly we get it in a clinical practice. Oftenly associated with stress and many things. Of course, many times they come without symptoms also. They found it clinically. Sometimes they will have real symptoms like severe pelvic pain or a frequent urination, constipation, including the premenopausal symptoms and all. Again, here the Mamsadhadu, considering the Mamsadhadu and Vata association, we may think about the formulas like Varnadi, Kubulichiktagam, like Varnasaidik Yukmishadavari, that yogam, or Kanashadavadi, good yogam, or Gumaram Kashayam. These are all are in a different range. When you have more Kapha, Vata dominant, then Kubulichiktagam may be better. So if you want to increase a little more Pitta in situations and all, Kanashadavadi may be better choice. Like that, you can think about it and you can use it. Prescription like Abhayarishtam, even the Varnadi Ganam, Varnadi Kashayam is available in the Arishta form, Varnadi Arishtam, and like Kuguludiktam in the Dimbam Rasa form, also found very, very effective. Varnadi Kridam, another medicine which is called Pulingoyamba. Actually, this is a formula of Sahasra Yogam described in commonly in a Kerala practice. We use postnatal care medicine. Pulingoyamba is a powder form, not Koyamba doesn't mean any Thailand here, or like a Yamagam or nothing, but it is a name in Malayalam. It's a powder form, not like a powder, it's like a powder fluffs, like a small, larger part of it. Hingujadi and Pulingoyamba is also very good result when we use it in long time. So now let's move to the second part of it. I would like to say some of the challenging diseases that comes in a clinical practice. That is the Kampavada or the Parkinson's disease. And also we'll speak about some fatal diseases like a motor neuron disease. So of course, you're all well known about this Kampavada disease or the Parkinson's disease. Nowadays, it is alarmingly increasing for multiple reasons. In the classical textbook, we don't get the disease Kampavadam, only Basavarajiam has explained in the later centuries. But Kampa, Stamba, Chestahani, Vakpravarti, that Panjagasam, Chirakambam, Shoni, Vankshana Vedana, in the Kasa Jigilsa, you get this slogam in the Jasna Dikritamento. But there is no direct description. Since there is no independent description in the textbook, we are free to think and make our own postulation, so we can plan management according to it, so that it will be more easier for us. Of course, the Kampavada, many movement disorders are there in our practice. We get hypokinetic movement disorders like like spasticities and Parkinson's disease, one called hyperkinetic movement disorders, like chorias and tremors, dystonias. There are many diseases comes under that. It's very late to identify. Parkinson is identified only in 1817. So, but we can see in our textbooks many descriptions. But actually, Basavarajiam described in, I think it is in 17th or 18th century, that book is. From a Nidana point of view, it is nowadays this is alarmingly increasing, maybe due to the following reasons, because it's affecting the Uttamanga, because it's an Marmabhigada is there, largely due to the lifestyle problem, the food habits and alcoholism, and the role of pollution is very, very critical in these concerns. It may be air pollution, water or soil pollution, especially the usage of pesticides, preservatives. This is a really large role to play in the Parkinson's. One of the simplest thing, the Parkinson's disease premonitory symptom is anosmia. I was oftenly asking the people, this comes with tremor, especially in the early intentional tremor, early diagnostic perspective of Parkinson's disease. I'll ask the patient. So nowadays I cannot ask this question because anosmia is a very frequent association with COVID. But before that, before COVID, I used to ask the patient, what is your, how is your smell? Most of this patient had at least from 2 to 5 years before itself, they'll have an absence of smell repeatedly. Very repeated, absence of smell repeated. And another interesting thing, if you ask the patient to write in a board, not in the book, write in a board, in a horizontal and a vertical column, you keep it in, ask them to write. Even few years before itself, they will have a change in their scripture, but it is very uncommon to identify. Some school teachers or those who are using by and large in the board can only be detected. But anosmia is a very common thing found. Drugs like lithium, mood elevators like lithium or sodium valproate, anti-epileptic drugs, anti-emetic drugs. Very common. People, those who are having travel sickness, they oftenly take drugs like anti-emetics, like sometimes they will take to stop vertigo and things like Spironolactone or Avomin, this type of thing. But long duration, these are all having a lot of problems as a contributor of PD. And consumption of manganese, carbon monoxide, mercury, there are so many other things. So our Dushi Visham is to be reviewed at this context, and also Janabada Dvamsam should be reviewed at this context. And of course, what symptomatology we get, we are all very familiar with this Samba, Kamba, Chestahani, Smriti Bhramsham in the later stage, and Deha Brahma, then Nidra Nasham, Vaksangam, Krura Kostada, frequent constipation may be there, some chest urograha may be there, Bhaktarotha, difficulty in deglutination also there. Chilsa Manjari, there is a chapter called Bhaktarotha. Krana Nasham, anosmia is a very common thing. So it starts from a simple early PD, that is, as you can see in the slide, starting with the one, then go to the next and next. But when we compare this whole thing, so the Chirakalina Sanjita Dosha. So there is a Chirakalina Sanjita Dosha is there, then Daldulina Amavastha is the basic things happening. And maybe a Bija Bhaga Dushti may be there, some Kavai Gunya may be there, Mastulunga Apachaya, Narmabhigada may be there. Of course, this is a Tridosha Dushti is there, that is it's almost incurable. We may improve the quality of that. Maybe Vada Kapha type, maybe or Kapha Vada type may be there, because of spasticity group is also there, tremor dominant group is also there. That's what I mean to say. Samba Pradhana group is also there, Kamba Pradhana group is also there. That means Kaphavada Vyanavastha is there. Hastakambam, Shirakambam. So we have Kaphavada Vyanavastha is there, where we have more hypokinetic, Samba Pradhana category is there. On the other side, when we have Kaphavada Vyanavastha and all, whereas Kamba Pradhana categories also there. We see many avarana situations also there. And of course, identifying the onset, duration, chronology, and localizations are very, very easy. So I don't want to describe those things. And as you can see, the dosha dushti is vadakapa pradhanam and kapavada pradhanam. If it is vadakapa pradhanam, kamba, spurna, etc. Whereas kapavada pradhanam, we have gadimandya, alpaka, vaksangam. And the funny thing that problems stays 20 or 30 years before. The origin, as I mentioned, people will say, I have anosmia 10 years before. 10 years, 15 years before, they will start getting it. The tremor, a simple tremor, often people will think, oh, this is maybe due to my anxiety. People may think that, oh, this is maybe due to my nature. Whenever I get a little bit excited, whenever I get a little upset, I have some tremor. No. Sometimes it's not necessary to be. So the whole problem is abayo lakudapuna. It's very difficult to identify Purva Rupam in the Vadavyadi Vagbadasi. Abhyakta Lakshanam Desham. So while planning the treatment, this approach is very nice. So keep it in mind that you have Kamba Pradhana Chikitsa, then you have Stamba Pradhana Chikitsa. If we have Kamba Pradhana Chikitsa, that means we are addressing the Kamba Pradhana. So Vada Pradhana Anubandha is a Kapha. So such situation, avoid Ruksha and Shita. If you try to give some Churna Pinda Sweta, or if you try to give some too much of Shita, it is not good and you don't get very good results. But if you start with Brahmana Chikitsa, okay, you start with some Abhyanga, then some Patrabotali Pindasvedam, then later on to Kaya Segam or Murta Taila. Beware, there is an Ama and Avarna may be there. So beware of it, do it, you'll get good results. Virejana and Vasti, excellent. Virejana is an excellent, if the patient is fit to it, go for a Virejana or Vasti. Egega Prasadna or Erandamuladi Vashaya Vasti is a role in the Vasti Kalpana. Excellent long duration. Nasyam, definitely part of the treatment is absolutely. And again, you have to teach the patient to do Nasya even in the house. If possible, do some Mahamasha Taila or Sahajaradi Savyam or Dhanandaram Savyam for Snehapana, not the routine ghees and all. Then go for a Virejana. Then for a Vasti, if everything is, if the patient is fit to have it, you will get very, very good results in the Kamba Pradhana. But whereas you have Stamba Pradhana Chikitsas, here Kapha Pradhana, Kapha is the dominant situation. Here you can do Rukshana really well. So if you apply Ruksha Chikitsas, any Langhana Chikitsas, you will get very good results. Even you can do some Vamana, even at least Koshta Vamana. Definitely, we have found that some people have significant improvement in the expressions, better in the things. Varuni Tailam is an excellent product to have Virechana in a daily basis. Varunya, Uttaram Mulam, Puttidam to Palatraya, Hastakambam, Shirakambam, Manyastambam, Padevacha. So typically mentioned for these type of tremors. Very simple formula. Varuni Tailam is also there, or any Eranda Tailam. Chandravasta Erandam, Nimbamrita Erandam is a good choice for that. And Kridamandam. Kridamanda is a very good for Nasya. It is not available in the market regularly, but you can use it as a medicine. Shirabala, Dhanandaram, Rasatailam. The Nasya with the Kabigachu, Belamulatok, Ashwagandha, Shirapaka. You make it at Shirapaka. There will be Ashtagunam Niram, Shiraniram, Chadurgunam, like that. You make Shirapaka and make use of Kabigachu and Belatok, Ashwagandha. It can be all, even orally can be given. The Dvipanja Sachagamam Sasya, that was in the Ashtangardem Vasti Kalpana, Dvipanja Muladi Vasti, Rajayavana Vasti in the later stage. You maybe start with some Madhudaili Vasti, Madhudaila Samayakasha, Saindavudi Vichovishi. So instead of Erandamula, along with Erandamula, depends upon Avastha, you may mix Erandamula with Ashwagandha or Erandamula with Bela. You have freedom to do that. That yoga, we can use it. Rajayabanam and Vrishyavastis can be later. And single drugs like Leshuna, Chitraga, Shilajatu, these are all having very good results. Sarvam Chavaranam Vitta Samsarga Vivardhitam Rasayana Vidhanena Leshuna Handi Sevita. In the Vadarakta last base is the Leshuna, garlic, usage of garlic. Only thing in the Pitta Prakriti, too much of Pitta aggravation has chances are there. So please avoid in the Pitta dominant situations of Pitta Prakriti, Pitta season. Otherwise, Leshuna usage in a small quantity is very good. Chitraga Rasayana is available in the market. Shilajadu, Brahma Rasayanam, long run, very good result. Swarnabhasmam also found almost all the Vrishya and Vajigarna medicine. Even Vrishya, of course, patient may be age about 70, 75, but you try to give most of the Vrishya medicines, Sadavari, Vajigarnam, all our Ashwagandha Rasayanam or Narasimha Rasayanam, all our Vrishya medicines have very good result as a shamana. In most of the Rasayana medicines also very good because of its that classical formulas having all of Vrishya, maybe some of the ingredients are Vibhana Pajanam, Shodho Shodhana, so is there that way. Whenever you have Stambhavastha, try to use medicines like Rasona, Garavi Krishna, like Rasonadi, Bhadradarvadi or Ashtavarga. When there is a Stambhanavastha, try to use Shodho Shodhana Swabhava medicines. But if you have Kamba, tremor is the dominant one, then Dhanadayana Shundi, Dasnograham Dhanadayanadi, or Maharasnadi, or Vidaryadi type of medicine you use, you will get better. If it is a mixture, sometimes we have both, bradykinesia also there, sometimes we have tremor also there. Then better you use balance of both like Drakshadi, or even some Anulomina medicines like Nayomagya, or Mashatma Upper and the Vatyalagashdam Vivek, that Mashatma Upmadi of Vaidyaratnandi is a good choice. Again, Ashwagandha, Bala, Gokshuda, Kapibachu, if the patient is poor patient or some patient ready to do some pana daily, some drinks like a panagam every day, like a toyapagam. Ashwagandha, Bala, Gokshuda, Kapibachu, Shadiba, these are some of the medicines. You ask them to prepare like a panaga, drink it every day. Or even Sahajara, Bala, Kapikachu, Shadafa, like Shidapaka, Brishya Medya Rasayana, as I mentioned. Kapikachu is a medicine can be given. Very oftenly, people will start with medicines like dopamine or like a Parkinson, many medicines. If it is in the initial stage, it is even in the Kapikachu, better not to give in the initial stage, start with all other medicines. Then later on, you switch on to Kapikachu and all if needed. And as a shamanam, medicines like Dhanvantaram Gudiga, excellent in many situations. Shaddarana Churnam, excellent in Dushi Vishadi Gudiga, found very effective. Sometimes we don't know how these are getting good results because maybe it is doing some Shodho Shuddhi, some Sadhvagni Vritti, like that. Kaivisha Parihari, Vilyuadi, Manasa Mitra, Ras Kasturi Bhairavarasam. These are all some of the good examples, out of box prescription. Sometimes we think that, okay, these are already fixed, okay, this condition, this medicine. But as a clinician, we have to always think out of box, why can't we try this medicine? Okay, this may be prescribed or described in a different context, but let us use it and try to explore it. That's always needed. And things like, very importantly, are the patient to stop using mushrooms, cashew, badam, and all these type of things found negative against the shellfishes, dry fruits, chocolate. And also many studies shows that food prepared out of aluminum, copper, food prepared out of also have some problem. Be careful about it. And oftenly we could ask the patient to use unpolished rice, cereals, goat meat if they are non-vegetarian, grapes, leshunam, moringa, goat milk, sarsavatilam. Of course, pranayama, meditation and all really very good. And it's also very nice that usage of coconut milk. I strongly believe that, coconut milk is one of the common ingredients in Kerala in the payasam. Because one of the common payasam available in Kerala is called Idichibinya payasam. Because they make a coconut milk out of it, they will take use of it. I think this medicine, this payasam could be one of the great medicine, because many temples or many traditional festivals, even in the house, there is a practice of preparing this payasam, and very oftenly people will use coconut milk. Nowadays, people are not doing it very well because they are hesitant to work so much, because it's not easy, because you have to scrap the coconut, you have to squeeze the milk out of it, and it's a little bit laborious in the action. So they will think of doing some other type of payasam. But I think to prevent, even to prevent Kampavatam, coconut milk has a significant role to play. So, in generally, Agnibala should be maintained a good stage. Keep a Niramavastha as much as possible. Very important. Avoid Vegadharana. Good sleep is a great contributor. Do Rasayana in the person best fit for it. And very importantly, if you are admitting a patient for Panchakarma or admitting treatment for hospital, you try to mix some Langhana Brahmana like thing. For example, if you are done Navarakiri, Shashtikashali Pindas for a few days, then switch on to Udvartana like Langhana type of Dukshana type of treatment. Then again to some Brahmana, like this type of mixture found better results than the continuous usage of either Dukshana type or Brahmana type. And very importantly, keep them make very confidence. Never let them not lose that hope. Now, the last part of it is the motor neuron disease. So I started with a simple common problem. Now we are going to very challenging, fatal manifestation called a motor neuron disease. Probably you might have already come across with this problem. One of the progressive neurodegenerative disease resulting in the death very short span. And oftenly neurologists will be hopeless. They will say to the patient that condition is progressing, whether it's a progressive bulbar palsy or it may be an amyotrophic lateral sclerosis. They will say it's very difficult to handle, and often they will come to Ayurvedic practice clinics asking some support. Maybe a UMN or LMN for motor neuron or lower motor neuron, commonly presented with wasting, fasciculations, corticospinal tract signs, sparing the intellect and sensory perception. Still, very unfortunately, I would like to say, an effective treatment is not available. We are facing a lot of problems in handling motor neuron disease, but of course in modern medicine too. But we are maybe if you are practice continuously handle such cases long duration, we could definitely able to bring good results. And so I put some light on our experiences, what we have done, and some challenges too. I should say some challenges too. You know that once a case comes in a clinic saying that it's MND, maybe people will little bit hesitate if the person is very new, because average life expectancy is just 2 to 5 years. So it is risky for a medical doctor to take a disease if his already life expectancy is too short, and it may bring a little bit defame, because if he's a new practitioner or if he's a practitioner who is looking for a career in a better way, so they will try to avoid such cases, because oftenly it is a very, very challenging. Moreover, death can happen at any time due to the respiratory failure. So let's see what we can do. So let's see some of the etiology. Of course, it's still unknown etiologies there. Autoimmune abnormalities, free radical. There are so many theories are worked on the modern science, saying with the presence of heavy metals like copper, zinc, cadmium, lead, many viral infections, polio infections. For example, nowadays with COVID also made a lot of increases in the motor neuron disease due to the autoimmune challenges, including the viral infections. Nowadays, also other reasons may be due to mitochondrial abnormalities and other things. Smoking, high dietary gluten intake also makes it. So from Ayurvedic point of view, it is ahara aggravating to vata, or Vihara aggravating to Vada, creating Agni-mandya, some Visha, Ushi Visha is there. Specific factors, very specific factors may be there for aggravating Prana, Udana, Vyana. And it's also producing a lot of damages in the neurons, enhancing the motor neuron apoptosis, the apoptosis, the death of the neuron happening, maybe due to the pro-inflammatory cytokines, or it may be a neurofilament dysfunctions, maybe also some calcium homeostasis. Still, it's in a discussion or still in a complex area. From Ayurvedic point of view, the whole Samprapti, put it in a complex way. One side we have Kapha Prakopa Hetu, then we have Kleda, Avlambaka Kapha in the brain and all, creating problems, some Agni Mandya, Samavastha, creating a Vada Kabija Roga. Other side we have other Pranodana Vyana, Vada Prakopa Avastha, that creating a Vada Prakopa and some avarana of combining both these two reasons. So what is the clinical features? Fasciculations, cramps, cold paresis, difficulty in turning the key, doorknob, opening bottle cap, awkward walking, foot drop. People will say that, doctor, I was not able to open my door. I have some problem. They may think about Parkinson's, or they think about some other thing. They may think that, okay, because it's a very popular, Parkinson's and all very popular nowadays. Sometimes the husband say the wife is walking in a one side, that the awkward walking is happening. They say that I have some difficulty in my foot. Maybe the speech, when we have progressive bulbar palsies and all, slurred speech, or maybe siloria, that means excessive salivations of course it happens in the sleep very often to the many people, but other than that, excessive saliva happening, maybe dysphagia, emotional incontinence, head droop, dyspnea, musculoskeletal issues also may be there, exaggerated responses to the things you can see in the things. So I'll put some pictures, very easy. You see, look at both the arms, one side, the thenar and hypothenar muscles. You see the changes in the muscles, typical muscle wasting you can see. You see the muscle wasting there. It can be clinically diagnosed, but it is, of course, since it is a very chronic, progressive, degenerative problem, it is better to go for a confirmatory things and go further. Most of the time nowadays, diagnosis can be done by many other things. And you see this before immersing the cold water, after immersing, you see the changes of the finger. Oftenly we see this type of finger change immediately when it comes in our mind. Okay, it's a swan neck deformity of rheumatoid arthritis. No. This is something else. Out of the whole MNDs, 10% is the PMA, that is the progressive muscular atrophy. Pathological restricted to the element clinical features. Age of onset is earlier. Fasciculations and cramps. 25% is the progressive bulbar palsy, where typically starting with the bulbar aspect of it. Oftenly, they will have difficulty start from the mouth. Whereas in the previous progressive muscular atrophy, the symptoms will start in the extremity. Maybe a fasciculations or a cramps and extremities and all. Whereas in the PBP, that is progressive bulbar palsy, starts with speech, difficulty in mastication, chewing, difficulty in deglutition. If you ask the patient to put their tongue up, so they'll have some fasciculations of the tongue. Sometimes the lower face may be lagging, may be there. Actually, PBU, progressive bulbar palsy, is very, very much more fatal than the previous one. So as you see the tongue, you see there's a changes in the tongue. Okay, of course, it's not a video here. So there's a small fasciculation is also there. You see the change on the face deviation. It's not due to the Bell's palsy. Of course, it's not due to the Bell's palsy because it's the bulbar muscles involvement is there. And small proportion of people is having the primary lateral sclerosis also. This is another challenging case. And of course, we have 10% of pseudobulbar palsy also there. As we know, disease is insidious onset, progress over months, and fatality is there. If you are a very good Vadavyadi management, if you are a senior practitioner, take the case. If if you are a very young practitioner, only just 5 years you are graduated, better don't take such cases. Refer to your teacher, refer to your friend. If you have a great enemy of your friend, you refer to him. I was joking. Because because when you have challenges cases, you can refer to your a friend who is your previous enemy in your graduation time, because these type of cases are generally very tough to treat. And but if you're able to improve the quality of life, definitely you are doing great things. The challenge is that patient will be aware of the disease only when the day-to-day life is affected, just like walking difficulties or degglutination difficulties. Of course, in the progressive bulbar palsy, a little bit better because the symptoms will manifest faster, easier. But when they say they have a little bit difficulty in the fine movement, some cramps or some stiffness, generally people will neglect, okay, this is okay, something is there, we'll keep on. So very severe Vata Prakopa Lakshana, Avyakta Lakshanam Desham. So it's already manifested. So severe Karshya, Mamsachosha, Spurana, Spandanam, all this comes. Avarana Lakshanas are also there. Anyonya Avarana Lakshanas are also there. Very dangerous. Mostly when you prescribe, if you do initial snehana, cold exposure, continuous rukshana, snehana, also sometimes rukshana also, you have anubhashya. You give some giving abhyanga, okay, looks like muscle wasting, okay, you're given mahamashadailam abhyanga. Okay, first 2 days, patient will say, doctor, I'm feeling better. But after a few days, people will say, after a week or so, people say, condition will worsen. Because of the avarana, even though it looks like very dhadukshaya manifestation, beware that there's a lot of avarana is there. So initially do Vibhara Pajana, Anulomana, some Uddvartana in the local area, Dhanyamlathara, very good. Dhanyamlathara is a very good do things. Then later on you do things are better. As I mentioned before, generally prognosis is very bad, except there are flare-like syndromes and flare-arm syndromes, which are a little bit better. Otherwise, generally, Sadhya Sadhya is a very bad prognosis. But if you treat properly in a treatment principles, start with Avarana Chikitsa. Then you identify it as a Kevala Vada Chikitsa. Then Vadahara Chikitsa. Then go for Rasayana. At least the whole period you may be able to extend the quality of life, no doubt. You could improve the quality of life. I'm not saying that you can cure the disease. Even modern medicine, they say that. But the whole course, if they survive for 5 years, if they survive for 8 years, during the whole period, we could be able to improve the quality of life. We could be able to minimize the symptom, and somehow we could be able to get some result in it. But we should take these type of cases because as a clinician, it is our responsibility too. So keeping the ideas like in a protocols like in our mind that Avarana Chikitsa, Vadavyadi Chikitsa, Shosha Chikitsa, Dushi Visha Chikitsa, Shodhana Chikitsa, Methya and Rasayana. These are the set of things we have to keep it in mind. These are the things to be in a long duration. These are set of things, protocols we have in our mind to be done. Depends upon the different stages of the disease. So you may start with the Dibana Pajana, maybe Google Gashayam or Gandharvastadi Gashayam or Chirulvadi Gashayam or Panchagolam Gashayam. Maybe medicines like Pippalyasom, Dashimolajira Ganishtam, like this, or Vaishwanachonam, Shaddaranam, like that, or Uddvartanam like Triphala, Kulatha, or Polagulatha, Churnam, Dhanyamlathara locally. So you start with these type of medicines. Only when you feel Snehana is fit to do it. Again, I want to highlight that be very careful. Every time whenever we do Snehana, found clinically that condition worsens sometimes. But of course, how far we can do Rukshana, there are limitations. So definitely we have to do some Snehana. Because of extreme of Rukshana, again, it looks like a Dhadukshaya manifestation is there. So Tilatailam, Mahamashadailam, Thirabala. If it is a progressive initial stages of progressive bulbar and all, Yashti Kashayam Vamanam, simple Vamanam may be possible. You do it very good, improve the things. But if it is an established disease, we cannot do it. Gandharva Erandam, daily Virachanam, Anudailam, Shirabala, Kridamandam, Mahamashavarti, excellent. Many medicines like Ashtavargam, Sajradi, Bhadradarvadi, of course, we already I spoken these medicines well. Jeevaniya Ganam, Kalyanagam Kashaya. These are some of the good drug of choice you can start. In between, try to give some Dibana Pajana medicines like Nayobhayam or Saptasaram Kashayam, or give some Hingojadi Churnam. These are all medicines which is having meantime Vada Shamanam, Kapha Shamanam, meantime Dibana Pajanam. Dasmularishtam, Ashwagandharishtam, Sarisudarishtam, like medicines. Kshira Bhagam of Divaniyaganam, Vidadi, Mahamashatailam, Dasna Dashamulakshadam. These are some of the medicines. Again, you may start with Churna Pindaswara, that is Churna Podikiri like things. Then try to use Abhyangam, but may careful that you are using Thailam, not too much of Brahmana. Maybe you may start with Chinjadi or Masha Saindavam or Kappa Sastyadi, like medicine. Lakshadi Thaila Kairam, coconut oil for the head. Then you may go for Patra Podali Pindaswara, that is Elakri like things. Then you go for Chira Dhumam. Chiradhumam is excellent. Simple Chiradhumam with the Bela Moolam or Dashamulam would be of great usage in such cases. Gandhadailam Nasyam and Gandhadailam Pichu is also very, very effective in such cases. Vidajya Churnam, Ashwagandha Churnam, these are also very, very effective. Whenever you want to do, actually, these are the procedures could be very, very helpful for these type of diseases because it's a progressive neurodegenerative disease. Kaya Segam like Pichil, Shashtika Shali Pindasegam like Navarakiri, or Shashtika Lebam, Navaratepa, Shirovasti, Vamanam. But careful that only when the condition, Upashya Anupshayam, look at the Upashya Anupashya, how the patient feels good or bad. According to that, you may administer. Otherwise, you may have challenges. Again, Rasayanam is a great role to play. Brahmana Rasayanam, Shilajidu Rasayanam, Leshunam and Navanidam Prayogam are also there. Swarna Basma, very, very good choice. Sahajaradi Savium, that failed leg syndromes or monoamyotrophic situations and all. Sahajaradi Savium was done by Jomon Joseph. Many of the observations also, I have been learning this and discussing from many people and trying to learn from different people. One of the participants here, Dr. Shyamakrishnan, used to give a lot of information to me. One of the senior medical officers used to share me many times whenever we have conversation. Dr. Jomon Joseph from Nilambur used to share many of his observations. We used to share with many senior physicians in Kerala. Also, whenever we had patients of MNDs in our hospital, so I took a lot of information from different people. Also tried different formulations, by and large largely from the classical formulas, so that we could be able to bring best results. When patient is having dyspnea, dysphagia, dysarthrias and all, Velajiragadi Kashayam, which is told for Kasadi, and Kasturi Galtarasadam, Kalyana Gavaleham like medicine. If it is a supranuclear palsy, Kalakoramba Rudraksham combination, Siddha Magadadvajam, Bhratvada Chindamani, Eganga Vedasam, also found very good results. Pradimarsha Nasyam, if there is a fatigue, HXC, this type of things, ensure few things, ensure nutritional sufficiencies. Major threat is about the dysphagia. There is a chapter in the Tilsa Manjari Bhaktarodham. There are nice formulas mentioned there. And we try to give these medicines and found some good results. Of course, it's a Malayalam book. I think nowadays available in English also. Tilsa Manjari. Most of the time, the threat in MND is that because of the collapse of the respiratory failure, collapse of the respiratory areas is a big challenge. So whenever we give food, we have to be very careful because of fluid diet is very important. need of fruits, fiber-rich vegetables, and unpolished rice is a real need of it. Fish, pulses, especially meat soups and other also. Again, nowadays, a lot of technologies and facilities are supporting this are also very significant. Judicious usage of walker, wheelchairs, splints, wrist drop, head drop supports are there. I've forgotten to put some of the pictures of it. There are so many technologies nowadays that happen for motor neuron disease. Hope you remember a famous great person who is well known for motor neuron disease. You remember that Stephen Hawking. Stephen Hawking. Okay, nowadays we have a sophisticated wheelchair. We have a lot of challenges. Nighttime oxygen supplies. Sometimes we have to put rails tube for feeding. There are challenges due to the progressive bulbar palsy, so we may go for a tracheostomy. Challenges are referred to a modern hospital for tracheostomy. Nowadays, a lot of studies are going on stem cell therapies also. Nowadays, a lot of YouTube videos you can see oral motor exercise, lip exercise, upper limb, lower limb. There is a statement says, when I cannot speak yet think, locked inside without any end, and knows very well my days are spent. How do I sigh? I wish to die. So these are people need really support, positive thinking, counseling, yoga, meditation, regular physiotherapy, cheerful people near and dear, and strong counseling is needed. And moreover, MND people need a lot of love we should give, because like persons like him under survived with motor neuron disease for many years, and he was one of the most of course most brilliant, most well-known person who has written excellent books on for the astronomical perception. So even this is one of the biggest challenge in the motor neuron disease, that their cognition, their memory, their intelligence are failed in most of the cases. So they can be really contributed to the society through intellectual way. So what I want to say at this moment, so the time is already 6:33. So I would like to stop at this moment here, because it's already 1.5 hours we spoke. So what I want to say at this moment is that Ayurvedic community, we have to see more and more challenging cases, and we could able to handle with classical medicine. If we are able to face such cases, and we could able to deliver excellent result with the classical products, there are innumerable formulas still not explored in the Ashtanga Hridayam, Charaka Samhita, Vaidyaratnavali, Yogamardam, Vaidya Manorama. So many books still we have. So as a clinician, I strongly recommend people to receive, take challenges for more and more challenging conditions, and make use of the classical time-tested seer-seeking. Seers are made this formula, so there is no thing. By these words, I'll stop, and I will open for some questions. Thank you for the organizers.
Good evening. Okay, good evening, doctors. My name is Shiju. I think we are good for now with an excellent presentation by Dr. Narayanan Nambi. We will go ahead and take some time for live question and answer now. Just a reminder, you can raise your hands or wait. You can also put your questions in the chat. Before that, we have two guests are here. So they are just sharing their clinical experience regarding the topic. First of all, I would like to invite Dr. Vinay Chowdhury, Kailash Pharma from UP. I think he is presenting here. Doctor, please. Can you hear me, sir? Dr. Vinay Chowdhury?
I can hear you. Can you hear me?
Yeah, sure. So please, sir. Please unmute your mic. Okay, 1 minute. Sir, please. I heard you once. Yes.
Yeah. Are you getting me right now?
Yeah, right now it's okay. Fine.
Yeah. First of all, I would like to congratulate Nambi sir for a nice presentation, and it was really a pleasurable moment to listen him regarding some classical kalpas, because nowadays people they are hesitating in using classical yogas in clinical practice, and especially he highlighted some yogas in some difficult disorders like MND. I would like to ask a question from sir, that whether he can found, like he while telling treatment for MND, he mentioned Ashtvarkam, Dhanadhanayanathi, then Bhadratarvadi as useful kashayam. So I would like to ask sir that whether he found some difference in between Bhadratarvadi and Ashtvargam, because both the kashayam, the nature of the kashayam are very, very different. So while starting the treatment, suppose the patient comes to us, and while starting the treatment, as we consider it as an avarana phase, so whether it would be a better idea to start with Bhadratarvadi, because Shosham is also an integral part of the illness. So Bhadrataru, I found it as little Brahmana kind of kashayam, because it contains Balatvayam along with Dashmut. So regarding experience, I would like to ask whether to start with Dhanadhanayanaadi or Ashtvargam like kashayam or Bhadratarvadi kashayam.
Dr. Vinay, sir, I think I usually start my prescriptions, start with Ashtavargam, not Bhadratarvadi in the beginning.
Okay.
Because maybe you may start with Dhanadhanayanaadi also, no problem. But Bhadratarvadi could be used in later stage. So initially we start with Ashtavargam or Dhanadhanayanaadi. Then you switch on to later stage, maybe after a few weeks of giving this medicine, then switch on to Bhadratarvadi, then go to Vidaryadi, later to the Maharasnadi like Brahmana or Brahmana medicine. But challenge what I mentioned again is that whenever we are giving Brahmana medicine, it is also to be remembered that often we have to give some Depanavajana in between because of some underlined Shroto Shodhanatva, Shroto Shuddhi. Unknowingly, there are some awareness happening somewhere in the system. So it's a very deep-rooted issues. From Ayurvedic perspective. So we give little short lengther of Brahmana, then immediately patient symptoms will exaggerate. So that trickiness is there. So that has to be considered. That's the only thing we have to see, especially in the MND cases.
Right, sir. Okay. Sir, one more question. While mentioning the treatment part of Parkinsonism, you mentioned this Swarnabhasmam. I have also observed good results of Swarnabhasmam in degenerative kind of illnesses. So how much is your preferable doses of Swarnabhasma? As I used to give 5 milligram of Swarnabhasma with other medications. So I would like to know about your ideas about the drug, whether we will have to go for a smaller dose or we can increase this dose, 5 mg.
If the patient is able to afford financially, definitely we can go from 5 to even to 20, 25 milligrams. It is fine. But only thing, it has to be affordable thing. But it is true, it is found very effective. Swarnabhasmam is found very effective in such cases. The problem is that with this medicine is about the expensivity, and many times people will also a little bit suspicious, when we say it is okay, it is a gold bhasmam, patient client may be little bit, suspicious. If it is a modern medicine, people will say they will accept it. But some Ayurvedic people will say, okay, this is expensive. This capsule is costing 100 rupees per day, one capsule. And we say it is containing gold. They'll say maybe it's not gold. That challenge is there.
Sir, one more question. Sorry. In Unimo series, we have one Chandanadi Kashayam.
Yes.
In Mastikshaya Adhikar, Roga Adhikar, Chandanadi Kashayam.
Yes.
Can we use that particular combination in MND?
It could be, but this Chandanadi Kashayam is getting more result when you have later stages of neurodegenerative things, like when you have cognition and memory issues, like in a Parkinson disease or dementia cases. You know, when you have a CT saying that there are cerebral atrophies, there are cerebellar changes are there, Chandanadi Kashayam is better. And Chandanadi Kashayam also have other dimensions. Clinically, if you have children with ADHD, you are not able to control the hyperactivity of the child. This Chandanadi Kashayam will work well. In autistic children, this Chandanadi Kashayam work well. Whenever you have hyperactive related these are things due to some Vata Prakopa is there, so Vata Pitta symptoms are there, Chandanadi is fine.
Okay. Sir, last question.
Yes.
Hello, are you getting me?
Yes, please.
Sir, while using this Nimbamruta Erandam, Sindhuare Erandam, like Virechana for Avarna regular use for regular purposes, I was referring, though I belong to Uttar Pradesh, but I was referring a compilation of Moose sir, 500 prescriptions were published in Malayalam. So one of my friends from Kerala, he translated it for me, and many cases I referred. He used to prescribe one simple formulation for Virechan. That was Airand Tailam with Nimbu, Swarasa, and Shundi along with Saindav Lavana. This was the combination in every kind of avarana he used to give. Whether we can use this on regular basis or once in a 3 day, once in a 7 days, or shall we go for the medicated oils like Nimbamruta Irandam and Sindhuara Irandam?
I agree that it was Neelakandan Moose, Memories of Neelakandan Moose book. It is true that castor oil, but castor oil combination with the Shundi, this combination is very effective. But only challenge what we have is that patient has to get these things readily available things. Otherwise, because many times people may not be able to get these things easily. Such situations, we have different Eranda combinations like Gandharvastha Thailam, we have Nimbamruta Thailam, or even, for example, back pain and all Sindhuara Erandam. Like simple Eranda preparations are very effective in Koshta Shuddhi and this Avarana blockage situation.
So we must go for medicated Erandam rather than going for simple.
The thing is that problem in the Eranda Thailam, what we get nowadays, we are not very sure that it is get rid of Amatum. That's why in the Vaishya Ratnavalikara mentioned about Murchana of Tila Taila, Murchana of Khrita, Murchana of even Eranda Taila. So that's the thing. But once it is readily available like Nimbamruta, Erandam, that risk is already overcome.
Okay. Anyway, sir, it was nice talking to you. And one more request, if you could arrange a CME physically, because, we are, personally, I'm not very fond of these, CME by using this Zoom meeting. So it's a personal request, if you could arrange a CME which is physical and we get a chance to listen you physically, it would be a wonderful moment for us. Thank you very much.
Sure, let us try in some time.
Yeah, thank you. Okay, sir. Nice talking. Okay.
Okay. The next one, I would like to invite Dr. Panchajanya Kumar from Vijayawada. Sir, please come forward if you hear me. Sir, are you there? Dr. Panchajanya Kumar?
There are few questions already in the chat box.
Okay, you can answer.
I
Do you
will-
want to make me to read or?
Yeah, I will read and I will answer it.
Okay, fine.
The first question was management of numbness in carpal tunnel syndrome. That's, I think I already mentioned. The thing is that it's always challenging to reduce the numbness. So simplest prescription what I do is one is an Nimbamrdasavam and Shaddharna Churnam. In a regular basis, they have to take morning and night. Second thing, I used to ask the people to have daily Abhyanga here on the wrist area, whichever the hand if it's affected, whether bilateral or unilateral. Then take a Karaskaradi Thailam. It's a good choice of oil. You apply all this area, or otherwise Chinjadi Thailam. Apply on this area and have a regular base of massage for a week or in a 10 days you will get started getting results and they will say they are feeling better. And secondly, a local upanaha churnam, like local upanaha, simple, if person is not too much pitta prakriti, take kotanjuka churnam, apply here and cover with a cotton, then put a wristband for an hour or so. That also gives very good result. These are the simple things. Generally, modern medicine, in the modern medicine, they don't have much prescription to do. Rather, they will refer to surgery. But with the medicines, very successfully, we could be able to tackle this problem. And most of the time, this is also have a comorbidity with a few diseases. One is with the dyslipidemia, second with the thyroid dysfunction. So if they are complaining of CTS, you check about the thyroid dysfunction. If they have thyroid problem is there, make sure that they are under medication or they are under control of that. Secondly, also with the dyslipidemia, especially about the LDL level or the triglycerides level is too high, give some of the medicines for that too, which will also help to reduce the existing numbnesses of the CTS. And the importance of Dr. Libin Joseph has written importance of moves. Dr. Libin, I couldn't get what did you mean. Can you switch on your mic and say what is that second part of the question? Dr. Libin, are you there? Okay. Yeah, Libin, please. Libin, please unmute and can you just elaborate? Yeah.
Can you hear me, sir?
Yes, Libin, please.
Sir, I want to know more about the Murtha Thaila. What all kinds of thylums we can choose in Parkinson condition, like Sajaradi or Dhananduram.
Murtha Thailam. You mean the Murtha Thailam?
Murtha Thaila.
Okay. First of all, you have to be very careful by using Murtha Thailam because it is also found a lot of people who are habituated to have too much of Murtha Thailam also have some problem, especially related with cervical spondylosis and all. Very oftenly, our friend Dr. Shyama Krishnan used to say that over usage of Murtha Thailam also producing a lot of problems. But it's also true that good application of Murtha Thailam is very effective. It is like a slow drug releasing system. In Parkinson's and all, some of the oils like Karpasasthyadi Thailam, like Mahamasha Thailam, Thanundaram Thailam, even Thanundaram Thailam, which is commonly used for external local massage and all, also found very effective in using the head and better for the improvement of Parkinson's disease. Okay, Dr. Libin. So I will go to next question. What is Thanada Nayanadi? Okay, Thanada Nayanadi is a kashayam. Thanada Nayanam is a drug called Kuberakshi. It is a formula. Thanada Nayanadi is a kashayam described in Sahasra Yogam. Thanada Nayana Shumdi Shiguru Rasnogra Gandha. That yogam mentioned for Ardhida, Pakshagada and other diseases. It is commonly available in the market. So this medicine is very oftenly prescribed, classically prescribed for the Pakshagadam, Ardhidam, but this medicine also have great potential for Shodhashodhana nature. Thanada Nayana Shumdi, Shigru, Rasna, Ugragantha. You see all the ingredients are very Tikshna, Ushna, Sukshma, Vyavai type of nature is there, having a potential to create a lot of Shodhashodhana. So wherever you are expecting a formula that should do Shodhashodhana, you can use Thanada Nayanadi without any fear. And even for long duration, we can give. In the Parkinson's cases and all, most oftenly we start with the Thanada Nayanadi and Varuni Thailam. It's a co-prescription that goes together, brings very good result because most of the Parkinson's patients will complaining of constipation. So Dhanadayanadi plus Varuni Thailam in the morning, maybe 1 teaspoon to 2 teaspoon, depends upon their gut mobility and the laxative nature. That is a initial prescriptions found very good result. Okay. I think
Yes, that was the few questions, and nobody wants to raise the hands.
there are during the session there are few persons raise their hand in between. I don't know by mistake or they really want to say something. Please. And I did. Dr. Shamakrishnan was also there in this presentation in the beginning.
Yes, one hand raised. Varsha.
Yes, please. The person who has hand raised, please, they can unmute and speak.
Hello.
Yes, yes, please.
Good evening, sir. This is Dr. Varsha from Thane. Actually, sir, I wanted to understand that you have told me that there is Chandanadi Kashayam, which is very effective in ADHD patient when they are hyperactive and they are not able to control their movements. So I have one patient which I have been treating since last 6 months, basically. So I have been able to improve his motor skills and even his grasping of writing skills and all. But yes, this is something which he keeps on blabbering and there is unwanted talk which he kind of repeat. So can you just help me to understand or to explore certain line of treatment which we can do in that patient so that we can help child?
Yeah, there are few prescriptions, few medicines which are very effective. One is this Chandanadi Kashayam. Second one is the Dhatriyadi Kridam. There is a ghee, Dhatriyadi Kridam, also found very effective in such situations. So whenever we have ADHD children and all, one side we should stimulate them to have by using Kalyanakam Kashayams and all. Because otherwise, if you keep on suppressing them, again there will be a problem. So I oftenly prescribe few period with the Kalyanakam Kashayam, which is actually a bit stimulant. They will be more attentive. They will be attention span will be more. But when you create more attention, in the meantime, they have a possibility also to have a distraction.
That is what is happening, sir, because I am giving him Kalyanaka Kashayam with the Gyanavalli Ghritam and giving Saraswata with the gold. And so what is happening is he's become active and he's started responding, but he's started blabbering also.
Yes, that's the thing. So short period Kalyanakam Kashayam will bring good result because the child will become more open, communicative, little bit extra communicative. or difficult for the parents to control the hyperactivity. So that time you give Chandanaadi Kashayam. So do one thing, you start Chandanaadi Kashayam in the evening or maybe in the morning. One time you give Kalyanam Kashayam, one time you Chandanaadi Kashayam, and find a balance. Do they are under any drugs like Levipril or any antipsychotic or mood stabilizers? It got hanged. I think she is traveling in a car. Dr. Varsha, are you there? Are you able to speak to me? You are mute. Please unmute and continue.
Sir, is it audible to you?
Yes,
Right
yes,
now?
I can.
So actually, sir, now initially he used to not speak in the class. He is in first standard. Now, once I have started treatment for like last 6 months, he's speaking too much. So parents that he's too much active now.
Yeah, that's very good. That's it. The way you started the treatment is you're in the right direction. So when you give Kalyanakam, Kashayam, Saraswarishtam and all, the Shrodha Shuddhi will happen. So he will start opening things. The problem is that you have to control him in the other way by giving Chandanadi Kashayam, Satriyadi Kridam, Gobi Chandanadi Guliga, this type of medicines you give, and you just suppress a little bit. But again, don't do too much suppression again, because if you keep on suppressing again, there'll be another challenge.
Oh. And so one more question, I'm disturbing you. Actually, last 2 years ago, I had this patient of MND, okay, and she was actually, her condition was not at all good. So, of course, she was like, her respiratory tract was infected. So she was unable to speak also. There was hoarseness of sound. Her cardiac profile was not at all good. So it was showing that her systems were going towards failure. And then at that stage where it was very critical condition, they came for Ayurveda treatment. So even that time I thought of doing Deepana, Pachana and doing, then I started with Purna Chandrodaya Rasa also. She showed improvement, but then too, by seeing her condition, I was in little skeptical whether to continue, because she was really in very bad shape. Like she was not able to walk, and then she was coming with the support. So then I felt better to just keep on her medicines where we can stable, and then I referred to the modern. So it's a bit risky. I feel somehow, I don't know, might be with the experience I would gain that. But when MND or I have patients of UTDC, which are like very rare cases, and they come in a very difficult situation, expecting some magic with Ayurveda, and where they have gone to 10 places, it's difficult to handle these kind of patients and treat psychologically them, basically. At this stage, I somehow feel that by maintaining their situation and doing certain things would be actually better. And the way you have told today, it was actually mind-opening, because there was a lot of things which would have been done, and we would have seen this.
Very true, doctor. Very true. Thank you for your information. It's very true, because when we keep on taking such type of risk, it will open a new area for the next practitioner to do something. And only thing, if you have to convince the patient, because there are a lot of situations when modern medicine people doesn't able to do anything. They are just running the show, just handling situation. But we have innumerable medicines in Vadavyati. We have innumerable medicines available, and why can't we try?
Actually, I was, it was really even doing Deepan Pachanam and basic treatment. Like I had a patient of fibromyalgia, and when I started with the Maitya, like Ashtavargam, Dhanadhanyadi and Balatailam, they showed a fantastic result. So really, it is something we should go ahead and start treating these kind of patients also.
Very true, very true. What is important is that we have to keep trying to get different cases, and we could able to we could able to do it because you know that if you visit to a neurological department of a modern hospital, there are large number of cases where there doesn't know the real etiology out of it. They doesn't know. I'm not blaming that. I'm not blaming any medical system. Rather, there is no option for them. There is no option for the even for the doctor. I have close friends. I used to take advices from many senior neurologists also. They used to say, okay, we don't have much to do. Why don't you try? Because you have so many things to do, but the unfortunate thing is that we don't know what to give because there is nobody there in front of us to guide us. Only so we keep on doing so that we'll be guided by somebody, at least by God grace, we'll get some result.
Yes.
Congratulations, doctor. That's the way you should proceed.
Actually, yes, that helps, sir, because I have seen like if your basics are clear and whatever case comes, and if you know the doshas which are imbalanced and you know the dhatu avasthas, and if you start reading, they show results, sir. Whatever is the pathology and whatever is the name of disease so called. But if you know the basics and you start treatment, it never goes wrong. At least not with me, it has gone.
Exactly. Very, very true. Very true. You're rightly said.
Thank you, sir. Thank you, sir.
Sir, we have a question in the chat box.
Good evening, sir. What treatment can be done in 62-year-old female with reduced analytical thinking and thus all over exactly opposite? Like if we say some way of not to doing this, she does exactly the same way. Actually, this has to be analyzed. What is the reason behind this? When there's a change in the analytical thinking, how does it started? Whether the investigation says about any cerebral or cerebellar changes. So what could be the neurological deficit? What is the brain damage that happened? Or is it simply because of the partial dementia or something like that? Depends upon that we can start doing it. Anyhow, if at all, if there is an analytical thinking, there is some problem in doing opposite things, you start with the Vadavyati management. So you do one thing, you start with a simple Ayurvedic preparation. That is Deepanapajana, mildly Deepanapajana, and Brahmana-like medicine. Maybe you start with prescriptions like Rasnadi Kashayam, or you start with some Vadavyadi Chikitsa prescriptions like maybe a Dhanadhanayana Kashayam, like that. And make sure that the Koshta is Anulomana is there. If there is some Koshta problem is there, start with some Gandharva Stadi Kashayam or some Nimbamradi Erendam. Like that, you start with from the gut. Because there's a gut-brain connectivity is really related with that. You start with that, then proceed with that. I think that's the point at this moment I can say about that case.
Sir, Dr. Panjaj Javindra Kumar is here. I think, sir, if you hear me, you can talk. I can see him in the participants list. So I think he is there. Dr. Panjaj Kumar.
He was there actually. He was his camera was also on in between. Maybe. Meanwhile, there is also a question. What can we do for low sodium in elderly? Very nice question. For sodium, it is actually a big challenge we get with the people with the low sodium. I oftenly ask the patient to prepare Nayobayam Kashayam. That is a simple ingredient, Bela, Jeeraka, and Nagara. So, Nagara, that is Shunti, that is Bela, Jeeraka. 2 drugs are already there in the house. Only Bela is taken. Prepare like a panagam. So like out of 2 liters, you make around 10 to 15 grams of this ingredient. Put it in a 2 liters of water. Boil it, not to reduce like a kashaya. And that medicine, that liquid can be taken regularly, found good result. If there is also association with the potassium changes are there, the fast and quick result is available with pineapple. So I found a good result with the pineapple. So I asked the patient to get pineapple if it is available. Have it once in few days, regular basis, if it is possible. Of course, in South India, especially in Kerala and all, it's very easily available, commonly available food, but may not be available in north of India, I believe. This is the cheapest and easiest thing what we do here. And again, instead of using sea salt, I used to prescribe our people to use the rock salt or the Saindava Lavana also. Found some changes in the cardiac activity because of the sodium and potassium changes often starts with giddiness, vertigos, and they will end up with some critical situation, referred to the hospital for checking the electrolytes. And there is another question about Amapachana. Can we prescribe some kritas which help slowing down degeneration of the brain? Okay, kridam, which is for brain Brahmana kridam. There are many kridam. One is the easiest kridam available in the market is Vidadyadi kridam. Vidadyadi ganam kridam is excellent. But so if you want to have Amapajanatva is also associated with the is that Shira Shatpala Kridam. Shatpala Kridam is there, Shira Shatpala Kridam is there. And that Kridam is also added in the extended to form the Indugandha Kridam. So the Pudi Gadari, the Samula Kashaya Siddham, that Shira Shatpala Kridam Indugandha. So Indugandha Kridam, Shira Shatpala Kridam are two of the good medicines, or Kalyanaka Kridam also have a very good result in degenerative brain. If it is something starting with the gut, better you can use Dadimadi Kridam because Dadimadi Kridam can little more starting from the gut, it can give extended results. There was a question about sodium potassium management. I think I already told about the sodium potassium management by using pineapple, using the salt and the niopayam, that niopayam water. There was another question: how to correlate modern investigation result in terms of Ayurveda? We have two hemispheres in the brain. One you keep for Ayurveda, one you keep for modern. And whenever there is a possibilities, the midbrain and pons and all, when it comes to join like that, being a teacher of last 22 years, I don't want to make it any comment saying that there are a lot of correlations are available. Rather, I take correlation whenever necessary. Modern is modern way, Ayurveda is Ayurveda way. But modern investigations are definitely will helpful for knowing many of the pathological situations. Many of the investigations are very strong indicators or like biomarkers to lead the progression of the disease. But while planning about the treatment, while planning about the dimensions of the Samprapti, Ayurvedic approach should have an independent approach without a bias of the modern science are much better. Let me give you a good example, just for a fun. In my practice, I was one day I was trying. Of course, Anup may be here. One of my friend Anup Peraur was also joined already here. So we were sitting in the OPD and we were seeing some cases. We don't see the investigative report. By rather, we just keep apart all the investigative report, just simply make a conversation with the patient and we think about all the Samprapti, Dosha, etc. and we prescribe it. Then later on we see the prescriptions. In some cases in the contrarical way, we see all the investigative reports in a peculiar way, and taking into consideration, we started making the prescriptions. But interestingly and very surprisingly, what we found is that the first method was better in finding the right prescriptions and bringing faster results than the second one. Whereas the second was much better to explain to the patient about the pathology, prognosis, even for giving better information to understanding and documenting things. So both have its own advantages and disadvantages in the level, because the original thinking of Ayurveda will take much more ahead of it many times to finding the right formula, right procedures, right dimensions. But on the other contrary, the investigations will really support convincing the patient, getting a better prognostic perspective from a modern point of view. Even it may make some possibilities of dimensions of the surgical, medical, etc. too. That's the thing. I think we are moving to the last part of it. If there is no more questions, I would like to say thankful to all the participants for finding time on this Sunday, spending almost 2 hours with the with me and whole SNA team. I deeply appreciate all the participants for their presence over here, and I deeply appreciate the effort taken by the SNA team for making such a wonderful program, making information diffusion, and making you more aware of the possibilities of Ayurveda in a better way. By this, I think it's the right time to conclude, and I'm thankful to all for joining for this program. Shiju, you want to say anything else?
Yes, I think, yes, we have covered all the questions. Now I would like to invite Mrs. Sridevi Raman for the deliverance of vote of thanks. She is the Assistant Sales Manager, Department of Outside Kerala Marketing. So please.
Thank you, Shiju. First of all, I would like to thank Dr. Narayanan Nambi for your speech on the subject, challenging conditions and best prescriptions. You have beautifully shared your experiences with special conditions, avasthas like that. I'm also thanking Dr. Vinay Chowdhury and Dr. Varsha for your add-on participation through questions. I'm also thankful to all doctors and other participants for your valuable time to attend the webinar and make it a successful one. Now, I would like to say that you will get the YouTube live link of this webinar in SNA YouTube channel also. You will get all the videos done by us through that channel. Please subscribe our channel also, okay? We will meet next time with other topic. Once again, thank you all. Goodbye.